Thank you everyone for the opportunity to speak today. So I've recently just undertaken my honours project with Sarah Wallace, Emma Finch and Ryan on the current clinical practice in aphasia outcome measurements in Australian speech pathologists. So as we know, speech pathologists can use measurement instruments for a variety of things. So this can be to screen for the presence of aphasia, all the way to using instruments to measure their outcomes of intervention. And this shows us whether intervention was effective or not. So when we are choosing measurement tools, we need to ensure that these are accurately measuring the therapy approach. So does our therapy approach want to be a decrease in paraphasic errors, or does it want to be an increase in communication confidence of our patient? There's been no recent studies in aphasia that provide insight into Australian practices, so we aimed to explore the current practices, specifically what is being measured and how it is being measured, as well as the perceived barriers and facilitators to outcome measurement use. So what did we do? So we utilised a cross-sectional online survey design, and our survey spanned 6 weeks from May to June this year. Overall, we had 74 Australian speech pathologists complete our survey, and this was from a variety of clinical settings, different stages post-stroke, and speech pathologists working across Australia. And we advertised our survey through speech pathology and aphasia networks and used snowball sampling to increase our responses. So we also had our barriers and facilitator questions, and these were linked to the theoretical framework. So this was the theoretical domain framework and the behaviour change wheel. So the behaviour change wheel utilises a COM-B approach, so C being capability, O being opportunity, M motivation, and B behaviour. And then the theoretical domains framework has 14 domains that are linked into this COM-B model. And these frameworks can guide and create a theoretical basis behind formulated behaviour change interventions. So what did we learn? So communication and language constructs are being measured most frequently if we look at the always and often responses, and whereas significant other and carer outcomes are rarely being measured in current practice. When we look at the tools which are being used for these constructs, there was a variety listed. So these are all the tools reported by over 20% of speech pathologists in our survey. However, overall, for language, the Western Aphasia Battery was reported most frequently. And then for communication, participation, and quality of life outcomes, it was the therapy outcome measures. And goal attainment scaling was being used for psychological and carer outcomes. When we look at the barriers and what speech pathologists were reporting, if you think back to that COM-B model, they were mainly mapped to the capability domain. And capability is defined as a person's capacity, psychological or physical capacity to undertake a task. And the highest kind of barrier statements linked to capability surrounded things like speech pathologists wanted more training in outcome measurement use. They didn't have a workplace system for reporting or recording outcome measurements. And they just simply believed there was too many outcome measurement tools to choose from. So although speech pathologists were motivated and are measuring multiple constructs within current practice, if we think about the barriers, there's perceived gaps in knowledge and skill, and these are barriers to optimal outcome measurement practices. So if you utilise the behaviour change recommendations provided by the behaviour change wheel, in order to increase speech pathologist capability, there's a need for a synthesised set of psychometrically robust measures for clinical practice, especially workplace policies for reporting and recording outcome measurements, as well as speech pathologist training around constructs and outcome measurement tools. And, by utilising these best practice recommendations, it may help bridge the gap in skills and knowledge, as well as the recommendations might further increase speech pathologists' ability to assess additional constructs, because they would understand how and what to measure constructs such as carer outcomes or psychological outcomes. Yes, thank you.